All right, so that helped somebody in Roswell, New Mexico, and I'm going to open up the mics again just in case you have a question. I'm unmuting the mics, and I'm going to take another question or two before we come to the top of the hour and run out of time. So if I'm unmuting the mics as fast as I can, did I get there? That one's unmuted. So if you have a question, the mics are unmuted. Please ask your question now.
Yes, Dr. Burris.
Yes.
What do you recommend? I know it's kind of similar, dementia and Alzheimer's. What do you recommend for someone who's kind of the health is degenerating pretty quickly and they've kind of been given up by the medical establishment, that they're not going to make it. I know, sometimes it's B vitamin, sometimes people are very deficient in that and that contributes to it. But what would you recommend overall, a program, a protocol?
All right. So we're okay. We're going to go back and mute the mics now again, and then we're going to talk about Alzheimer's, Parkinson's, these kinds of problems that are affecting the mind and our abilities. Oh, and that really does uh, mess up somebody's life when they're dealing with those kinds of things and they can't do the things that they have done all their life. They can't remember things. They may be tremors. There may be all kinds of things going on. Let's go over there to herbalhealthreview.com. I'm on my way over there, and I'm gonna look at some things here that let's see. There's Bell's palsy. There's autism. Um, I I really want to look at. There's depression. I think we're going to find some of the answers that we're looking for here. If I pull up a protocol that is going to talk about Parkinson's disease, because it's going to talk about how it's going to be talking about things for the mind, and and all right. So that report is coming up, and I'm gonna where you're not, you're it's a deficiency. Like, for instance, Parkinson's disease is a deficiency of dopamine in certain brain cells. That's what scientists are finding out. And that's basically what's going on as people are getting older. We've got heavy metals that are causing mental disorders like mercury and lead. And then we find that things like turmeric reduces inflammation and crosses the blood-brain barrier and makes people smarter and helps to fight off cancers and tumors. That's the research that I'm reading about it. And and we're finding out that an amino acid. We talked earlier about L-cysteine for hair growth. Well, now another form of cysteine called N-acetylcysteine. It's another form of the amino acid of cysteine, which is where the NAC is derived from. And cysteine can be found in most high protein foods, but the NAC is not actually found in the diet. So the cysteine can be synthesized in the body, whereas NAC cannot. And many people are choosing to take NAC as a supplement because there are several benefits that can give you that the regular cysteine alone cannot. First and foremost, NAC is found to relieve many of the flu and cold symptoms. And most notably, the NAC acetylcysteine, it helps break down mucus, and it can improve the quality of breathing for people with chronic bronchitis or excess mucus in the body. There have been people who have asked me, how can I reduce the amount of mucus that I have in my body? Well, we want to look at dairy products and bread and so forth to reduce that mucus, but also NAC or N-acetylcysteine will be very helpful as well, and as well with chronic bronchitis or COPD, and this N-acetylcysteine that well, it's let me see here. It has an antioxidant property that also helps protect lung tissues as well. It does this by helping the body synthesize another important antioxidant called glutathione. When this happens, it can protect the liver from some of the problems that it can face through toxins and chemicals. And see, we just hit on something here, because now we're looking at something that's helping the liver. And if we're helping the liver, because these substances are hitting the liver, they're hitting the brain, they're hitting the liver, and they're causing, they're making you feel like you're a lot older than you should be feeling. And that's why an amino acid like N-acetylcysteine is important. It does all of these wonderful things. And along with this, it helps to protect the liver from some of the problems that it can face through toxins and chemicals. Going to detox them. And along with this, it helps to prevent the body from acetaminophen toxicity, which a lot of people are taking a lot of this acetaminophen, for pain relief and so forth. And it's toxic. Well, N-acetylcysteine can help to protect the liver from that, from acetaminophen, and which is used for many patients that need it, and they're winding up with this acetaminophen poisoning. Anyway, N-acetylcysteine is a very interesting amino acid, and you take these amino acids in between meals, generally on an empty stomach, or just as long as it's not with food, because it competes with food, and we don't want to compete with the food. We just want to get the full blast of the N-acetylcysteine in between meals. It also works for hepatitis toxicity, as well as NAC supplements also have been shown to reduce the production of some cells that line the colon, which can help to reduce the chance of colon cancer for people who have had, they found polyps in their colon. And although technically no deficiencies in NAC have ever been found, it is the deficiency in cysteine that can be helped with NAC, which occurs with many patients, especially in HIV infected people. So this NAC, the N-acetylcysteine, should be taken by people who are suffering from some of the above things we just talked about. And it's not necessarily, I'm going to pull this over on the screen here so you can see it. Oops, I'm going to have to go like this first, and I'm going to have to go like that, because I'm going to show this report. I forgot that we got screen capture. So there, now you're looking at the same report that I'm looking at once we see the video. And we started here talking about Parkinson's and a definition of it. And then we talked about things that are going on, and we finally got down here talking about N-acetylcysteine and how value it is with so many different things. And by the way, it's important to talk to your doctor to see if something that you can use in one of your ailments. And this cyanohydroxybutene is a chemical found in broccoli and cauliflower and Brussels sprouts, which are come up twice today, and cabbage. And it's also thought to increase glutathione levels. And so there's a lot of information that this N-acetylcysteine has a great value in a number of different areas, and it may be available or may be valuable when we're looking to stimulate the memory. And there are memory stimulant herbs available as well. There's a memory stimulant formula. Number 1288 is a memory stimulant herbal tincture that can help with these kinds of disorders. And as well, there is phosphatidylserine. Uh, so there are things that we can do to enhance the memory and increase the ability. And of course, there's alpha lipoic acid that helps to prevent certain kinds of cell damage in the body and also restores vitamin levels of vitamin E and vitamin C. So as we go on here, talking about alpha lipoic acid, that can improve the function of the conduction of neurons in diabetes. And alpha lipoic acid is used in the body to break down sugars, carbohydrates, and it makes energy for other organs in the body. Alpha lipoic acid seems to work as an antioxidant, which means that it might provide protection to the brain under conditions of damage or injury. So that's why I brought that up. Now, the antioxidant effects might also be helpful in certain liver diseases. So alpha lipoic acid, 10 to 50 milligrams a few times a week in the morning with breakfast. So that's another one. And while we're talking about amino acids, let's talk about acetyl L-carnitine, because it's as a treatment for Parkinson's disease. A proper dosage of the combination of alpha lipoic acid, acetyl L-carnitine, as a treatment for Parkinson's disease remains to be determined, but it may be a good idea to start at a low dosage of 30 milligrams of the RALA and less than 300 milligrams of acetyl L-carnitine for a few days before considering taking higher amounts. The interaction of these two supplements with medications currently used for Parkinson's disease, it's not clear, nor is there interaction. They don't understand it yet. They don't understand the interaction with the muconopurines and other natural herbs and supplements. But combined with the acetyl L-carnitine combined with alpha lipoic acid exerts efficient preventative effects in a cellular model of Parkinson's disease. So we're finding that these are the kinds of things that are working with the mitochondria, the neuroplasm, the neuroblastoma cells. These are the new kids on the block, these amino acids and this alpha lipoic acid. When you combine things like that with coenzyme Q10, now you're delivering oxygen to the brain cells and the rest of the body. And and that the coenzyme Q10 about at least 20 to 50 milligrams. I take 100 milligrams every day. But that nutrient also improves energy production in cells. However, research with the CoQ10 and Parkinson's disease it's kind of got mixed findings. So we're not sure how well that works, but it has to have some value because it brings oxygenation. And then if you're combining, for instance, coenzyme Q10 with something like turmeric that crosses the blood-brain barrier, Now you're crossing the blood-brain barrier and you're making somebody smarter with turmeric powder or turmeric liquid, tincture extract, and then you're using CoQ10 to oxygenate the cells in the brain, and you're using L-carnitine and L-cysteine and so forth. You see, as you start combining these kinds of things, pretty soon you've got a powerhouse of nutrition that you're targeting. And when you're using things and you're combining it with quercetin, now you've got a flavonoid. Flavonoids increase the integrity of a cell. They make it stronger. So quercetin is another one. Selenium is an inexpensive mineral, and it's an antioxidant that helps to increase the levels of glutathione. And also it works against cancers. Selenium, according to the research I'm reading, and melatonin. It's an inexpensive sleep hormone, but it's also an antioxidant. And so taking some melatonin at bedtime can be very valuable. Maybe once or twice a week, the melatonin at bedtime. So, and another fairly new guy on the block is vitamin D. And the king of vitamin D is the everyday liquid sunshine vitamin D3 drops. And I take 5 of those little drops, which means I'm getting 5,000 milligrams. And you're only supposed to, according to the RDA, you're supposed to only need about 1,000. But they're finding that with really tough healing problems and really bad diseases, an increased amount of vitamin D3 is helping to boost the immune system for people to get over these kinds of things. Let's talk a moment about Withonia somniferea, also known as ashwagandha. Now, was found in a rodent study to be helpful for tardive dyskinesia symptoms. Although it's not known whether ashwagandha would be helpful in dyskinesia due to the L-DOPA induced dyskinesia. But anyway, a fellow by the name of Dr. Shahalian's wife uses ashwagandha and finds that it helps reduce her Parkinson's symptoms. So ashwagandha could be very valuable again with problems with the brain and with the nerves. And this ashwagandha is providing dopamine precursors to the L-DOPA, the immediate precursor to dopamine. And it's a nutrient available by prescription, the L-DOPA, and it's often combined with carbidopa. It's the most commonly used medicine to treat Parkinson's disease, by the way. And it's possible that the use of this L-DOPA for prolonged periods, causes oxidation and toxicity in the brain cells. So they're doing some studies on that, and so it could be a bad thing. Now, Parkinson's disease, it is possible that the use of L-DOPA for prolonged periods causes that oxidation and toxicity to the brain cells. If this turns out to be true, it would be further justify the recommendations that antioxidants be added to the standard Parkinson's disease therapy. So that would be a good idea, I think, anyway. Antioxidants, increasing those antioxidants, lots of cherries and cherry juice and blueberries and all these great antioxidants. We need more of them in the diet. And finally, when we're talking about this, let's talk about astragalus, because astragalus can inhibit the MAO type B and increase the activity of the antioxidant SOD, superoxide dismutase. We don't have any human trials to determine whether these two herbs would benefit patients with Parkinson's disease. They're astragalus, but it's another candidate. And additional nutrients and supplementation to consider. Some of the following nutrients may not be directly involved in making more dopamine, but it could well improve general cognitive abilities to provide other benefits. So we're talking about brain disorders and memory and so forth. And these are some of the herbs. Sea buckthorn seed oil, ginkgo biloba, ginkgo leaf extract. And of course, we talked about curcuma, turmeric. And then there's pregnenolone that helps with Parkinson's and stress. It just helps with stress. It's a very inexpensive hormone. And anytime you can dump a capsule underneath your tongue and hold the powder there, you're going to get 300% more absorption than if you didn't. That's right. Whenever you can, a liquid or a powder, hold it in your mouth and hold it under your tongue. We've come to the top of the hour here, and I should give out the telephone numbers before we say goodbye for this session of Discoveries in Health. We're here every Thursday from 3 until 5, praising the Most High and preaching about natural remedies. Our Father, which art in heaven, hallowed be thy name, wants us to be nourished, above all else, to be in good health, to prosper and be in good health, as it says in 3 John 1:2, verse 2. Yes, and we should do this. Please call the people at BetterHealthHerbs.com for any of these products and more information about them. BetterHealthHerbs.com, 541-791-8400. That's 541-791-8400. And my telephone number is 503-362-5899. Now, I don't always answer my phone, but I always return the calls. So if you stay on the line a little bit there and let it grab your number, I will call you back as soon as I can when you dial 503-362-5899. That's my number. My email address is Truman, Truman, at healthherbs.com. Truman at healthherbs.com. That's Truman. I want to thank you very much for joining us here on Discoveries in Health as I open up the mics here, and just in case someone may have one last thing that they wanted to say, the mics are now unmuted. And I want to thank every one of you and hope that you come and join us again next week here on Discoveries in Health.